I'm Mariska, 31 years old. I have PHTS and this is my story. Yeah, my story itself, I got diagnosed when I was 7 or 8, I believe, because my parents didn't find necessary for me to get diagnosed earlier anyways. And I don't really know if there was a reason to that age exactly, more of like, we should probably know just in case, and at least you can be prepared. So then my sister and I got diagnosed and my little sister didn't have it and I had. They think it was with my mom a spontaneous mutation. Like my grandparents never got tested, but my uncle did. Well, one of my uncles, the other one isn't alive anymore, and he didn't have it. So they really think it was with my mom's spontaneous mutation. So when I was a kid, I was a little of an awkward kid. I didn't have good of a muscle mass or my how do you say it, motoric. Like catching a ball was hard, or even walking sometimes I fell easily. So yeah, that was kind of the start, I guess. Yeah, I was aware, but I think when I really knew it was when I got like my first brace because of me having scoliosis. So I guess that's when I figured it out. So, oh, I am different in like the most preteen, tween word, because every kid is different. But then I figured out, oh, okay, something is going on. Scoliosis can be one of the signs that you have Cowden's, or one of the symptoms, I guess that's a better word. And with me, I have Cowden's, but scoliosis is on my dad's side of the family too. So I had like, which side? I don't know. I already knew like, okay, I want to have the preventive double mastectomy because, well, there's a high chance I will get it too. So I prefer having it, just making my own decision. I like making my own decisions. So I preferred having my own decision and just be like, okay, done with it. But then they thought I was too young, so I let it go. And then for a couple of years I went back, and then they still thought I was too young, but at least they wanted to listen this time. I went into the whole going to the medical psychologist to be all like, okay, is she okay? Going back multiple times to the doctor, do you still want it? Yeah, I would still want it. My mom immediately said, you should do it. If you want it, you should do it. And then when I finally got like the green light, my mom was also like, yeah, but I also have I have another breast that also can be affected. So then they were all like, okay, then you also go for the other one. So 6 weeks after my mastectomy, my mom got her other one done. Around that time, I also had like my ovaries where I had the borderline tumor that they will also say, you're too young for it. And I still got it. So I hated the excuse, or what they said, like, you're too young for it because, well, my body didn't get the memo. And normally a borderline tumor is not bad, not good. But for me, they described it more as a bad one because I was too young for it. And I kept coming back. So then they were like, I think it's better if you get your eggs, if you get your ovaries removed and your eggs frozen. And so I said, okay, we'll do that. So I got, I think, 4 rounds, and in total I got 26 eggs in the freezer so that I can use that forever. And if we decide to want to try to start a family. We don't really know yet if it is because of the Cowden's, because the borderline tumor itself doesn't fit in the list of stuff to have. Every year I go to the gynecologist and dermatologist. Every year I have blood drawn for my thyroid. Every 2 years my ultrasound for the thyroid. Once every 3 years the colonoscopy. That's it, I think. Yeah. The other recommendations are there for a reason. That's why it's important to make sure you follow everything. Talk with your doctor about it. talk to everyone that you can think about it. For me personally, I had a while where I knew September, October, that were the 2 months that I would have a lot of different kinds of tests. It just happened to be in that time. So that was my whole, okay, September, October. All the tests will be available, don't plan the big things because that's happening there. And then I can go on with my life.